Retinol is a popular skincare ingredient. It boosts collagen synthesis and reduces fine lines and wrinkles. But a lot of people are using it incorrectly. Today in this video, I'll tell you what are the common mistakes that are made while using retinol. Let's get started. First is using it without having a routine. Retinol is an ingredient that you want to start once you know and understand your skin properly. You understand the requirements of the skin, and also when you have a proper cleanser, a moisturizer, or sunscreen routine which is set, and you like all the products and all the products are performing well. Retinol is not something that you just start as the first product of your skincare routine. Okay, so if you don't have a routine, you just don't want to go ahead and pick up a retinol and start using it. Your skin will not tolerate it and you will not like using the product. So I would suggest first just use a cleanser, moisturizer, sunscreen in the morning and a cleanser and moisturizer at night. Know how your skin behaves, know how how these products suit your skin and how they work for you. Once that is set, then you can add in a retinol at night. Second is not practicing sun protection. So just using sunscreen is not enough. You should also try to actively avoid sun as much as possible. Try to avoid harsh sun exposure between 11 a.m. to 3 p.m. Even when you do go out in the sun, try to carry an umbrella, wear full sleeves clothing, wear sunglasses so that you're protecting your skin as much as possible from the sun. Okay, because retinol tends to increase cell turnover, also can lead to shedding of the stratum corneum layer. Initially when you start out, it can make your skin a little more sensitive and more prone to develop tanning. Okay, so if you're not practicing strict sun protection, then you might feel that your skin is getting darker after using retinol. So that's why, like I said in the first point, it's always important to first have a proper routine which includes a sunscreen. Use that for a few weeks up to a month before you add in a retinol. That way the performance of retinol will be better and you will not notice any darkening because of retinol. Third is using retinol on oily skin. Though retinol can suit all skin types, remember that if you have very oily skin, then it might be better to use another vitamin A such as an adapalene or a tretinoin. Both these adapalene and tretinoin are prescription-based creams, so please consult a dermatologist before using it. So retinols are usually dissolved in very moisturizing solvents, and the vehicles have certain ingredients which can make your skin a little oily, okay, because they are trying to target it to general population to make it more tolerable. That's why they do add certain, sometimes oil, sometimes humectants, moisturizers that can feel a little oily on oily skin. So I feel that if you have very oily skin, it's always better to be on an adapalene or a tretinoin. This helps in reducing the oiliness and also gives you all the benefits of retinol and much more. But because it has to be used in a prescription strength and it has to be used with a prescription under supervision of a dermatologist, people don't like to use it. But I feel that it is worth that effort. You need to visit your dermatologist maybe once every 6 to 8 months for a re-prescription. Till then, it will help drastically in improving your skin texture and also reducing your oiliness as compared to using just a retinol. Next mistake is starting retinol very early. People tend to feel that if they start retinol in their teens or before they even turn 20, they feel that the results will be better. Absolutely not. There is no requirement for retinol before the age of 25. Okay, you have enough collagen and there is no collagen breakdown that has occurred, so there is no requirement for using a retinol. I have a detailed video on teenage skincare. Do check it out. I have simplified the whole method of choosing skincare products and what products would suit you. I have divided it into oily, combination, dry and sensitive. I'm sure you'll find it helpful. But remember that if you're a teenager, you don't need retinol in your skincare routine. Before the age of 25, there's no need to start retinol. Instead, focus on luminosity of the skin. So you can use either a niacinamide serum, a vitamin C serum. You can just use maybe a little bit of hyaluronic acid. You can use a moisturizer, a good hydrating sunscreen. If you like, you can even use a snail mucin. But there is no requirement for a retinol at that age. Next mistake is using it with irritating ingredients. Remember that retinol can irritate the skin, especially when you've just started out. So you don't want to go ahead and use some acids, AHA, BHA, benzoyl peroxide, and a higher concentration of vitamin C. You don't want to use all these products when you're on a retinol, especially when you're starting out. So whenever you're using retinol, make sure that the other products that you're using are very gentle on the skin. They do not exfoliate the skin, do not irritate the skin. Because retinol can cause a little bit of dryness and flaking, you want to make sure to use only soothing ingredients, good moisturizers on your skin while you're using retinol. So no mixing retinol with glycolic acid, salicylic acid, or benzoyl peroxide, or vitamin C. You don't want to use any of these ingredients along with the retinol. You want it to be a standalone ingredient that you've added in your routine after you have tolerated everything else. Until your skin gets used to a retinol, you don't want to introduce any other acids into your routine. Next mistake is using multiple products with retinol. Because retinol is so hyped, people feel that that is the fountain of youth, and the more retinol you use on your skin, the better it is. But it is not. There is something called inflammaging, wherein if there is a lot of inflammation in the skin, that can actually hasten the process of aging. So you don't want to use anything that irritates your skin too much. That can again hasten the collagen breakdown and increase the appearance of fine lines and wrinkles. Okay, so we don't want that. So always make sure that you're only using one product with retinol. So you don't need a serum with retinol, then seal it with a cream with retinol, then a moisturizer has a retinol. No, using multiple products with retinol has no benefits. It can only irritate the skin. So just choose one product, like whether you like a serum or if you like a cream formulation, you can go for that, but there should only be one product with retinol in order to see the benefits. Starting at a higher strength. Like I said before, people feel that retinol can completely smooth out all your fine lines and wrinkles and give you youthful baby skin, which is not true. So people feel that if they use a higher strength of retinol, will be better for the skin. No, if you're a beginner, you want to start with just 0.25% of retinol, and after 6 to 8 months, if you're able to tolerate, you can go up to 0.5, and that's it. You don't want higher than that. So remember that whenever you're starting out, you want to start it very slow at a lower concentration, and also don't use it every night. Start with twice in a week. Once you're able to tolerate it, then you can use it alternate nights, and once you feel that your skin is not reacting, then you can use it every night. Remember that even when you use retinol 2 to 3 times in a week, you do reap the benefits of retinol. It's not necessary for it to be used every single day. So keeping that in mind, go for a percentage that is lower when you're starting out and start slow so that your skin can tolerate it better. Next mistake is using retinol too frequently. Some people feel that if they use retinol twice in a day, if they are not going out, the retinol is not going to get deactivated, so they can just use the retinol and use the sunscreen on top and they'll be able to see more results. That's absolutely untrue. You want skin to heal, to recover before it can take on the actives. Okay, so even when you are using any kind of AHA, BHA, you want to make sure that the skin is not irritated. So that is why the best absorption of a product is when the skin is normal and is not very irritated or dry or flaky. Okay, so you always want to make sure to apply retinol in normal skin when it is completely dry, not on damp skin, and also start slow. Start, like I said before, only twice in a week, and once you're able to tolerate it, you can use it every night. If you feel that there is a little bit of redness that you get with retinol, then you can stick with just twice in a week, 3 times in a week, or alternate nights. That is also good enough. You don't have to use it daily in order to see all the benefits of retinol. Basically, you need to find the correct retinol at the correct strength and use it correctly. That will give you better results rather than trying to use too much of it and too frequently. So these were a few retinol mistakes that I commonly encounter in my OPD, and a lot of patients do complain about these. So I hope you found this video useful and you learned something from it. If you have any other doubts regarding retinol, do let me know in the comments below. I will try to answer them all. If you like such skin and hair related content, you can follow me on my Instagram handle Dr. Aanchal MD, where I post such skin and hair related content daily. Yes, daily. Thank you for watching.